wanted to have a conversation today about the work that you've been doing with us in the Advanced Practice Review, and particularly our public advisory group, which you've been involved with. But I just wonder if you could tell us a bit about yourself and how you became involved with Stockport Birth Services.
Yeah, so Stockport Birth Services is my business. So it's a private antenatal and perinatal business. But I have worked alongside maternity services for actually about 12 years now, in one way or another, making sure that the women and pregnant families' voices are heard within maternity services, making sure that they are listened to, and part of that service production, because it's really important that patient and public voices are heard in that sphere, to make sure that services are as good as they should be for people.
And was there a particular reason that you set up the organisation? Was there something that prompted you, or was it just a lack of women's voices, family voices, if you like?
So it was something that really came through from my own pregnancies. Realised that information wasn't always as accessible as it could be. I found that we really had to go looking for information, and it was difficult to have quite nuanced conversations with services. And I thought that was really important that that we could work with that, and because I know that there's so many maternity staff that want to really do the best that they can, but there was kind of that missing bit in between, that interlink. So yeah, there was definitely an opportunity there, and there's some really good work happening now, 12 years later.
Yeah. What sort of things does Stockport get involved in?
So my Stockport Birth Services is a private antenatal business. So I educate people, families, about their antenatal options and kind of what the whole process is, talk about how they can navigate maternity services, which is really important, because until you go into it, you kind of don't really understand how it works, and how it, especially if you come across a more complex case, it can be quite difficult to kind of understand what is happening and what should be happening and where you go for different things. So that's a crucial part of what we explore during the classes.
Yeah, brilliant. Yeah, I can see that definitely the need for it, and the importance of the work you're doing, and that maternity, that kind of voice that we need to come through. How did you get involved with the work that we're doing on the Advanced Practice Review?
So I saw a call out for people to get involved, and I'm always looking for ways to ensure that public voices are embedded in work like this. And I thought it would be a really interesting thing to become involved in. So I've got obviously a great deal of experience of getting public voices into service provision. And this seemed like a kind of an obvious step, that working alongside an organisation that's doing kind of behind the scenes work. So yeah, it seemed like a really good opportunity to have the public voice heard.
Thanks, Meg. And yeah, the public advisory group has been a really key part of the Advanced Practice Review, and since we've formed the public advisory group, it's a group that other parts of the organisation tap into when they want to engage with members of the public. So it's become really important to us as an organisation. From your involvement with the group, what do you think the role of the public advisory group is, and how important is it?
Like you say, it's really critical. You've obviously clearly noticed that people are coming to you for more and more input, and I think that's definitely the way that public organisations like NMC are going. It has to involve patient voices, to make sure that the public understand what work is being carried out, and for also to make sure that the work that is being carried out suits the need and the understanding of the public. It needs to be right first time, instead of not quite hitting the mark and having to be redone. And I think that's where things like the public advisory group really come into their own to be able to make sure that that kind of work is being done and it's understandable by the public, and that it is also getting it right first time. What I like about this group is that it has got that direct link to the independent steering group, so that our feedback is going directly to them. And it was through this that led to the development of the public first definition, which I think has been really key to what we've been doing.
Yeah, and I'm glad you mentioned the independent steering group and that link, because I think, you know, our role as a professional regulator is we're in the business of public protection, aren't we? And actually having that public voice, we were really keen that that public voice fed directly into the independent steering group. And of course, it's the independent steering group that kind of reviews all the evidence and makes recommendations to our executive board and to council. But it's been really important, and the chair of our public advisory group sits on the steering group, so he feeds directly in, and that voice has been really powerful, I think, in reminding us why we're doing this work. You also mentioned the development of the public first definition. I wonder if you can tell us a little bit about how the public advisory group were involved with that particular aspect of the work that we've been doing over the past 6 months or so.
Yeah, so we have come together as a group, and what I really like about the group again is that it is representative of many different public voices. I think that's really important, and sometimes that gets missed a little bit when we're doing this sort of work. So it's been really good that this group has got that representation. And it's been a really collaborative project, I think, to make sure that we are really very clear about where our starting point is and the goal that we're trying to set out and achieve, and working really hand in hand, and having really interesting, nuanced conversations about how we get there. And we've definitely had some very interesting discussions, even just about the minutiae of just one word and how that might change things. And I think the greatness of this group, having that time and the scope to be able to do that and really make sure that all of those definitions, all of the words are serving a purpose in that definition. And I really do think that because we've had that scope and we've had that time and space to be able to do that, I think it's made sure that we've got exactly what we need to have got out of the definition.
Yeah, I think that's really important. And you're right. We've had some really tricky conversations, and I always say I feel like the group holds us to account, and is really quite vocal about, you know, what that lots of other things, but particularly what the public need to see in a definition. And I know that we've ended up with a public definition and a professional definition, but we've also had those conversations to make sure that you as the public advisory group are happy with that decision going forward, and that the professional stakeholders are happy as well. And you're right, it's being able to have that scope and that freedom to get involved in the work, but also, I guess, to feel that work and that contribution is valued, which it sounds like you do feel.
Absolutely, it's really meaningful work, and it kind of on the face of it, you just think, well, it's a few sentences, but actually in a clinical setting, it's really important for the public to understand who's treating them. And it can be quite a confusing thing to understand at the best of times, let alone if there's a medical situation happening. And I think having this really clear definition that can be given to the public, that we know has gone through a really clear process to make sure it's one that's really accessible to everybody, it's really valuable to those patients and their families. And then because of that, they can understand who's helping them, what their remit is. And I think that that transparency is really important in the work that APs do. And I think that comes from the public first definition.
Yeah, absolutely. I think that's great. Do you think the role of the advanced midwifery practitioner is growing? Is it something that you see more of when across the sector when you're talking to women? And yeah.
Yeah, I think it is. And I think it's, again, I keep using the word, it's becoming more nuanced as well. There is a lot of specialities and specialisms coming up in maternity services. Cases are becoming much more complex, and I think it's right that having a very clear definition for the service users to understand who it is that they're seeing and what it is that they're seeing them for is really critical, because some caseloads are seeing many different specialists because they've got so much going on in their pregnancies, and having that understanding of what is actually happening in their specific care can only be useful for them.
Yeah, I agree. Thanks, Meg. So we've been talking a little bit about the principles and the public first definition, and we've got to the point where we have a set of principles, including that definition, which we'll be taking to council at the end of this month, the end of March. What difference do you think those principles for advanced practice will make? And I suppose for the public, but specifically for women and their families?
Yeah, I think if we're considering it in a maternity setting, when we're thinking about transparent information and nuanced conversations happening, it's really going to make sure that pregnant people and their families understand what's happening and who their team is. Having the principles in place will give that definition and transparency to roles and make it a lot easier for women to understand who's looking after them and why. And I think that this will increase the trust in the relationship, which is really critical when we're thinking about maternity specifically, and what's going on. It's important that we've got this trust. It's such a pivotal and transformative time, which relies on the bonding and trust hormone, that actually having everything just underpinned by just honest and transparent conversations right through to the definition of who is looking after you is actually really, really critical to build those relationships in maternity.
Yeah, Thanks, Meg. It is really important, that transparency, as you say, and creating that understanding. So yeah, we're really excited to have to see the principles as they currently are. When we started back developing the principles and the public first definition, we didn't quite know where we were going to end, but really excited to take those to council and then launch them shortly after. I wonder also if you could just share with us your thoughts about how the NMC can continue to ensure that the public voice is heard in the work that we're doing. So thinking about advanced practice, but also thinking about other things that we're doing.
Yeah, of course. Carry on doing what you're doing for a start. The public advisory group for this particular bit of work has worked really well, and I think it has shown that it's useful and necessary to include public voices in programmes like this. But also remember that the public voice should be represented from start to finish in all projects. That way you know that each project is always going to consider the needs of the wide range of people that the public is made up of. Continue having the champions of public representation, because I think when you have champions working within an organisation who are constantly talking about public voices, then it makes it the norm to include those voices from the outset and all the way through, and not just a tag on at the end, which sadly is what some organisations do.
Yeah, I think that's really important, and I like that you know, having champions within an organization who are, you know, it's part of the conversation, it's part of the work that we do. So like you say, it isn't just an add-on at the end that we need some public members of the public involved in the work, but it's we have that involvement from the very beginning. So I think wise words for us as an organization there, Meg. So thank you. Is there anything else, Meg, that you wanted to share, or that I perhaps haven't asked that you wanted to have an opportunity to bring into the conversation?
Only a thanks to you for putting out the call for the public voices to get involved, because I think it shows the commitment that you've got to the public and to making sure that you are getting things right, and the work that you've done throughout these last 6 months of listening to people and facilitating those conversations to make sure that not just everybody's voices are heard, but actually those voices are committing to the work that has been done has been really, really useful. So thank you, and it has been really meaningful work.
Thanks, Meg, and thank you. I think your contribution has been immense in as part of that public advisory group. But bringing that voice of maternity service users, women, and their families has been something that's been really important to us. And this is just the start of the journey, isn't it? We've got lots more work to do. And it is a phased project, introducing additional regulation, and it will take time, but having the public advisory group and the voice of the public as part of that work is really important. And we need to make sure that it continues, don't we?
Yeah, there's always so much work, but yes, we can get there.
Yeah, thank you. Thanks, Meg.
Thank you.